just been advised to undergo a colonoscopy at Hiroshima University Hospital. In this video, we'll explain what a colonoscopy is and what to expect. This is Hidehiko Takegawa, a doctor in the Department of Endoscopy. Thank you for meeting me today.
It's my pleasure.
Could you explain what a colonoscopy is?
Colonoscopy is an examination of your large intestine or colon. The colonoscope is a long tube-like instrument that can reach all the way to the far end of the colon. The device is very flexible and contains the light and the camera. Other instrument can also be inserted.
Why would you need to get a colonoscopy?
A colonoscopy is often recommended if you have persistent bowel trouble, such as abdominal pain, diarrhea, or constipation. Or if you find blood in your stool, it's also recommended as a precaution in the older patients. Over time, small growths called polyps can form in your colon. They're usually harmless, but sometimes they can become cancerous, so it's better to have periodic checkups.
Are there any risks in colonoscopy?
The risks are very small, but we require you to sign a form indicating that we explain the risks to you and that you consent to the procedure. The most common risk is bleeding, but we can usually repair it at the time using endoscopy. Because the colon is very thin, there is a small risk of perforation or puncture.
What should patients do to prepare for a colonoscopy?
Your colon has to be empty to do the colonoscopy. We will give you laxatives on the day of the procedure, but it's important to begin preparing ahead of time. For example, a few days before your appointment, you should avoid eating foods and drinking liquids that are hard to digest, such as fruits, raw vegetables, and milk products. You should also avoid red meat and foods that are greasy or spicy. On the day of your appointment, you shouldn't eat anything and drink only water or tea.
How do patients know when their colon is empty enough to start the colonoscopy?
After a quick checkup, we will give you laxatives and water to drink. You will drink 1 to 2 liters of liquids, which will make you empty your bowels 7 to 9 times. When you begin to see only a clear yellow liquid, press the call button next to the toilet, and we will check to see if you are ready.
What do patients wear during the procedure?
You will given some special clothes and slippers to change into. The pants contain an opening at the back used to insert the colonoscope. You can put your personal items in a locker in the changing room.
Will I be awake during the procedure?
Unlike Western countries, we don't usually use general anesthesia for colonoscopy in Japan. Instead, we use light sedation to reduce discomfort and keep the intestines from moving too much. But the patient is awake during the procedure. You can refuse sedation if you like, but if you do receive sedation, it's very important that you avoid driving or riding a bicycle. Instead, you should arrange a ride ahead of time or take a bus or taxi home.
What happens during the actual procedure?
First, the colonoscope is inserted all the way to the cecum, which is the farthest point where the colon joins the small intestine. This is the most time-consuming part of the procedure. Once the colonoscope is fully inserted, it's slowly retracted and the colon is carefully photographed and examined.
What happens after the procedure?
Then you will stay in the recovery room for about an hour for observation and to allow time for the sedation to wear off. You will change back into your regular clothes and dispose of the colonoscopy clothes. Finally, you will meet with the doctor to discuss the findings and schedule any follow-up procedures.
Is it okay if I eat after the procedure?
Yes, but you should gradually ease back into your regular diet. You should start with clear liquids and easily digestible foods like plain yogurt and white rice.
Thank you very much for your explanation.
It's my pleasure.